everyone gets a one-on-one sitting with myself. I like to meet every one of the patients. It's for the patient to get to know me, and for me to get to know the patient, to see whether the chemistry is right. Then we start to talk about some of the desires and what the patient wants to achieve. I show some examples of before and afters. Then we may take some photos and I assess the patient to see what we may be able to achieve and some of the things I would recommend to be able to get there. It's a lot of just getting to know each other and know the surgery in somewhat some detail, and I then give them some education material. Now, the APHRA, the Australian health regulation, does require us to have minimum 2 consultations, and with my patients I sometimes have 3 or 4. I like to give them as much time as they need. The second consultation I try to focus on to address some of the questions that we may have raised in the first consultation, as well as going through the surgery in much more detail with the risks and complications. I often walk the patient through the surgical experience, coming through the anesthetic bay, meeting myself and the surgical team, doing some of the drawings, preparing for the surgery, and then coming into the operating theater room. Very often I introduce everybody to the patient and the patient to everybody else. And also what happens afterwards, whether there will be a garment, what drains. Some patients will be having intravenous antibiotics. Some patients will be going home on the same day. So we'll go through all those kind of surgical expectations. Very often, a third consultation is done because I find that some patients come to see me for the first time. They don't quite know what to expect. They don't quite know where they are on their surgical journey or surgical plan, if you want to call it. And some of them might still want to get a bit fitter, lose another 3-4 kilograms. Some of them may not have the social situation arranged as well. They may have a family of 4 kids and they may need to arrange for one of the relatives to come and stay with them for a week or 2. So if that needs to be arranged, sometimes I like to arrange for a third consultation a couple of weeks before the surgery, just to make sure that we're ready to go and everything is nicely planned and ready. The last thing I want to do is make a patient feel like they're not prepared going to the surgery.